ViaDisc NP is a procedure we use to be able to treat degenerative discs. Age-related wear and tear affects discs over time and causes loss of hydration of the disc itself. The disc material consists of a nucleus pulposus and annular rings that go around the nucleus. The disc itself is meant to provide stability and allows for flexibility of the spine. When the disc starts to lose hydration, we lose some flexibility and we can develop pain. One of the ways we lose flexibility is because the disc itself loses hydration, which leads to degeneration. Age-related wear and tear of the intervertebral disc can cause loss of hydration and degeneration, as pictured here. This type of degeneration leads to lower back pain and loss of function. The ViaDisc NP is disc material that we can inject into the disc itself to repair tissue and repair damaged discs. It is a procedure performed under X-ray guidance. We use a 22 gauge spinal needle as pictured here, and we use X-ray to make sure the needle goes right into the disc. The ViaDisc NP comes in a prepackaged syringe. We inject it into the disc material itself. This leads to supplemental support of the disc itself.
All righty, everyone. Sorry about the delay. This is Dr. Rao. We're talking about ViaDisc and answering some questions. First question was, can this be something we can do in the cervical or thoracic spine? Unfortunately, it is only FDA approved to be done in the lumbar spine at this time. Any other questions? Will I be put to sleep? Yes, we can offer sedation at in a surgery center setting. We can offer IV sedation to put you to sleep for the procedure. If that's something that you've used in the past for other types of procedures, then sure, we can offer that as well. I have a pain stimulator in my back. Is this the procedure for me? Well, if you have a pain stimulator in your back, this is a procedure that still can be done despite having the stimulator. The stimulator hardware is actually in the thoracic spine, and the injection will be going into the discs in the lumbar spine. So it is still definitely an option despite having a stimulator. How effective is this treatment? Great question. So a recent study has come out that shows that 85% of people who have had this injection at the 1 year mark are still reporting at least 50% improvement, which I think is a very good assessment of effectivity. So it's nice to see that people are reporting improvement in function and pain relief even at a year out. Now, obviously, that's not for everyone, and some people do have results that last longer, and some people who have results that last shorter, but we are seeing good results with it. Can it be done on an outpatient basis? Absolutely. These are outpatient procedures. We do them in a surgery center setting, so we're using sterility techniques to make sure we minimize the risk of infection. The procedure itself is done under fluoroscopic guidance or X-ray guidance. It is done similar to other injections that you may have had done. We'll have you lie on your belly, clean off your back with a sterile preparation. We will give you IV antibiotics prior to the procedure, and to minimize risk of infection. We will numb up the skin, and we'll place a little needle through that numb area into the disc. We'll inject the disc under X-ray. The whole procedure takes about 5 to 10 minutes to do. Can it also be done with radiculopathy and spondylosis or spondylolisthesis? Yes, it can be done with all of those other issues. So if you've got back pain with numbness, tingling, and pain radiating down the legs, if there is arthritis in the lower back, or if there's even movement in the bones in the lower back, this is still a potential option for you. So next question is, if I have back pain and I'm on pain medications, including opioids, would this be the next step for me to consider, or would a spinal cord stimulator? That is a difficult question to answer across the board, but I would say in general, this can very well be an option to try. It is not an implantable device, so it is just an injection, so it's nice in that sense. The stimulator, spinal cord stimulator, is still also a good option. It is something that we do as a trial before we implant the device, so you get to see what type of pain relief you'll expect to have. But either could be the next step after you have completed epidural steroid injections or radiofrequency ablation types of procedures. Then either the stimulator or this ViaDisc could be the next step in treatment. Next question is, if I have cervical spine damage, can I have this procedure done in the lumbar spine? And the answer to that is yes. It is safe to have to perform this procedure in the lower back, even if you have pathology or problems in the middle back, thoracic spine, or cervical spine. How often can you have this done? The procedure itself can be done. Each level can be injected that is degenerated. So if there is lack of hydration that we believe is causing some of these symptoms, then each level can be injected in the lower back. I would recommend spacing out repeat injections at least 6 months apart. I'm told that I have a step off on the L4-5. Can it still be performed? We'd have to look at the imaging, the X-ray and the MRI, to see how much of a step off there is, and if it's safe to have this procedure done versus something different. Is there any downtime or recovery? This is not a surgical procedure, so there's no real significant downtime. It is more like any other type of injection. So you may have some soreness and muscle spasms in the lower back for 2 days to up to a week, but there is really no limitations after the procedure. So someone was asking, they had a procedure a long time ago that the doctor was asking what I felt when I was doing the procedure, and it felt like a cramp. And he said that's what we was looking for. That sounds like a different type of procedure altogether. This has not been around for a very long time. It's been FDA approved for about a year. So the procedure that you may have had in the past is probably a different type. Will this disease paralyze? I think if the question is there a risk of paralysis with this procedure? There is a potential risk if that is on the risk of potential risk anytime we do any type of spine related procedure. I think it's a very unlikely risk given the precautions we use, as well as the technique being used. The X-ray helps make sure that the medicine and the injectate is very precisely used and placed to minimize those potential risks. Next question, I have a stimulator. Will the insurance still cover this? And the answer is yes, it should. Right now, we know Medicare does cover it and other insurances are starting to. We have an authorization process or team in place that can go through the works to try to identify if your insurance will cover. Next question, I broke my back 2 times in a year. Is this a guarantee that this will work? Unfortunately, no, there's no guarantee with anything in medicine. Having spinal fractures can happen from multiple different reasons. This may not help your fracture risk. Actually, I would say this does not help your fracture risk at all, but may help some of the pain that's developed since. We'd have to review the imaging and see what the MRI shows. Is this covered by most insurances? Medicare, we know Medicare does cover this procedure, and most other insurances are in the process of adopting it. We have an extensive authorization team in place that can review your insurance, your policy, and figure out if your insurance company will cover this procedure. Why would my legs be numb on some days? And is that a symptom of this disease? Well, the legs can be numb because you have a compression of certain nerves in the lower back, which send signals down the legs. The legs can be numb because a nerve is getting compressed. We can do an EMG, nerve conduction velocity study, to better figure out if it's coming from the spine or it's coming from the leg itself. And yes, it could be a symptom of this disease. Next question, are there more permanent and longer lasting injections? There are different types of procedures that we have to offer. We hope for the longest lasting response to any injection. We try to cater the treatment choice based on the specific symptoms that you're presenting. So we don't try to make it so cookie cutter. We want to try to individualize this as much as possible. There may be longer lasting options, but all of it comes down to seeing how well does it work on you versus the next person. Will I need physical therapy after the procedure? Physical therapy could be helpful after this procedure to strengthen the core and the lower back muscles. That is a good option. We do recommend that with certain types of patients, depending on what we're trying to treat. Would you recommend to use wheelchair or walker if legs go numb? Yeah, if your legs are falling numb, then I think it's important, one, to get in to be evaluated by a physician to get a better understanding of why they're going numb, but using some type of device such as a wheelchair or walker to help support you so you don't fall would be helpful. As a rule, do you feel that this is longer lasting in general? The data that I just reported shows 85% of people still report relief at 1 year out from the injection, which is very promising and supportive. So I think this is a procedure that we can expect to provide longer lasting results. I had 2 back surgeries since 2020 and a stimulator. I had to take the stimulator out. Will this procedure do or make it better? This might be an option if the pain is coming from the discs themselves, and if we can support the disc and provide some better elasticity within the disc because of the injection, take some of the irritation off of those spinal nerves, then this may be something that could help. Next question. I've had injections to burn my nerves. Does this affect that? Burning of the nerves is called radiofrequency ablation. That is a procedure that we do to treat pain from the joints on the sides of the spine that cause muscle spasms. This is a different type of procedure, treating a different condition altogether. If you've had the radiofrequency ablation or burning of the nerves procedure, you're still a candidate for the ViaDisc injection. Once again, this is an outpatient procedure. If you have questions and you'd like to discuss in greater length, you can email us and we can follow up with you either by the phone or we can schedule another appointment. The procedure can be repeated, I would say, every 6 months if we needed to. We can provide sedation to put you to sleep for the procedure if that's what you'd like. This can be done locally in Altoona. Okay, I think that covers our questions. Any other questions? We're here to help. We're here to answer more questions. If you have them, you can follow up with us in the office, and we'd be happy to answer additional questions. Actually, I've got two more here. Are there any criteria that need to be met for a patient to have this procedure? So the procedure is indicated for patients who have degenerative disc disease. So basically the hydration or the fluid in the disc has worn out, and that's what a common phenomena we see as we get older. As that happens, it causes for less what I call shock absorbency in the discs themselves, which can then cause for pain. So the disc, the indications would be having signs and symptoms consistent with degenerative disc disease, which we can review by how you describe your pain on physical examination and reviewing the MRI. There really isn't any significant downtime. It's no different than an epidural steroid injection or radiofrequency ablation. You may notice some pain immediately after the procedure in your lower back. You may have some muscle spasms for a couple of days, up to a week, but that would be the expected downtime.
All right, we're going to wrap up here. If anybody's questions were missed, we'll get those answered individually by email, and we'll also be sending an email with the webinar video to recap after this.